Aminophylline? Aminophylline or theophylline?
Either one. Yeah. Same brand. Same generic name. Aminophylline, theophylline, Slowbid. It's a xanthine drug. So that's very similar. It's a bronchodilator. It's an IV. So.
And this is what? Theophylline. No. I'm saying, what is it? What is that ID? What is that?
Theophylline.
You can do it almost all the
time. AMI.
3 treatments.
NIO.
Not responding. You can throw in some Atrovent if you want, right?
Okay.
Atrovent is like a 1-2 punch, right? You guys with me? This is 4. Okay? Albuterol bronchodilates, right? The Atrovent just stops it. That's it. That's what Atrovent does. I'm just going to stop you in your tracks. So I'm still constricted, but I'm just not going to constrict anymore. That's all Atrovent does. You can deal with the 1-2 punch with albuterol, Atrovent, right? They're not responding, go ahead and give them the Solumetal IV. Because if they're not responding, both components of the asthma have kicked in, or the COPD. Remember, you have bronchospasm or constriction, and you have swelling. So the steroids are going to take care of the swelling, right? If you're still not responding, go ahead and throw in the xanthine drug. It's going to get theophylline or aminophylline IV. And then if all of a sudden, you can always fix them with epi. Because epi is a bronchodilator. But usually by the time we get here, that's usually how your COPD exacerbation run goes. Because it can be that same combination for the emphysema patient having an exacerbation, or the bronchitis patient having an exacerbation. It doesn't always have to be asthma. If anybody, no, because it wouldn't apply for cystic fibrosis.
Everything's like that.
No. It's usually any of the diseases that have the active airway component to it. But you'll know because they give you those key words. They give you the patient is not responding, or the patient is in status hypoxemia, or status bronchospasm, right? Anytime they throw status in front is bad, right? Status is like they're staying there. They're not responding to traditional therapy, so you've got to kick it up and up.
Is that generally like when you've had the asthma attack, so you've been intubated before, right? Mm-hmm. So is that generally set so when you go, they hit you with a bunch of albuterol?
I've had so many combinations. The last one, I was at Huntington, and they actually, part of their protocol is they do magnesium. They do a magnesium sulfate treatment. Because magnesium is a bronchodilator. So they actually, when you start to, they put me on the continuous med, and then they started the IV Solumetal, and then they did the magnesium sulfate. But, it just depends. I know once before, doing the magnesium sulfate, they didn't even go any further. Because, you also, because sometimes you have other stuff. Like that's at the MDRC. Remember the MDRC kind of moves stepwise. But in real life, we don't have time to try not to know what the first indicator. So, yeah. For me, it's, it's like you should do something.
You know by now. You don't want to bring a list with you, like
okay, so next week, if you come back, I'm going to make you, demonstrate, right?
Is there a real one?
This is a real one.
And real medication?
We can't have real medication. And you guys are comfortable with setting up everything else, right? You don't need to do that. So after you demonstrate these for me, then we'll do,
ready for it? I thought somebody asked you.
That's
No.
not bad.
Yeah, I thought you asked her. Oh.
I have a question. The MDI and DPI, both are the same medication?
Some of them can contain the same medications. Like you can have an MDI fluticasone, and fluticasone will come in DPI too.
Okay.
That's just a matter of you just getting familiar with what medications are delivered in what type. The good thing about boards is they will tell you they're really good about saying the physician has ordered DPI, Lovent, parentheses, fluticasone. You know, they'll give you the brand and they'll give you the generic, and then they'll tell you exactly what it is. So that's the good thing about boards, that they don't leave you kind of guessing as which one it is. But as far as you being knowledgeable as a therapist, that's just a matter of you just becoming familiar with the drugs. But to kind of recap on what you guys were talking about earlier, remember that it's also going to depend on where you work too. Most of you will work in acute care facilities where you won't be instructing on DPI and MDI. But some of you may land a job in Barlow where they have a similar lab, and you need to go instruct the patient. Or some of you may work in rehab. It's really just going to depend on where. Or some of you may just be in charge of discharging the little kid out of ICU home. Or out of ER, just go home and you need to instruct them. So it's really going to kind of depend on where you work. But just as a student, you just want to make sure that you are aware of as many things as possible, because you don't know where your first job is going to land you. You know, and you don't want to be at that interview like, I don't know, or I didn't get a chance to do that. Because here, you're supposed to be able to do almost everything in lab. That's our whole job, is to prepare you, but to get a job anywhere. So, and you don't know where that's going to come from. You know, some of you may end up in a substitute. A lot of new grads end up in substitutes where it might be a responsibility for MDI. So, just depends on where you work. If you want to be prepared for anything, but if you're prepared for anything, then I tell my kids, you know, stay ready. If you stay ready, you don't have to get ready.
Mm-hmm. Don't get ready. Stay ready.
We all want that. Okay, so next week I will do airways and airway management. So that is all of suctioning, intubation stuff. Now remember, as I'm doing this, like everything I'm saying to you is all NDRC. So it might vary from what you see in clinical, but my whole goal is to make sure that when you come across these kind of questions, that you're able to decipher what it is and you really have a good solid understanding.
Thank you.
Thank you.
That's the whole goal.